Doctor, how many hairs can be taken during one procedure? The answer is a lot, but not infinitely a lot. During one FU session, a maximum of about 3,500 to 4,000 grafts can be harvested and transplanted. And do you remember from the lesson about grafts? Each graft contains 1 to 4 hairs, so in practice we are talking about 7 to 10,000 individual hairs in one procedure. 7 to 10,000. That's a lot of hair. It's a multi-hour procedure because we take each follicle separately, one by one. But that number is not universal. It depends on three things. First, the density of hair at the back and sides of the head. This is your bank. The thicker it is, the more you can withdraw. Secondly, the condition of the scalp and the follicles themselves. You cannot take more than the skin can safely give in order to heal properly. Thirdly, time. The procedure lasts from several to several dozen hours. The larger the team and the greater the experience, the more follicles can be harvested in one day. Such extensive procedures are best spread over 2 days so that the follicles do not remain outside the body for too long. It's not about speed here, it's about ensuring that each follicle survives. Of course, you can take 6,000 follicles as if there were no tomorrow, and that will be your first and last procedure. By taking such a large number of grafts, there is a high chance of damaging the neighboring hair follicles that are not taken, which means a double loss. But you can also take exactly as much as needed, wisely distribute it on the scalp, and have a reserve of follicles for the future. Maybe in 10 or 15 years, some densification will be needed. I operate under the assumption that it's always better to have some plan B for the future. Medicine is not a race. It doesn't matter who is faster and does more. It's important to think about the future as well. In the back of your mind, you have a certain number of follicles. That is your only donor bank. And if you take too much from it, instead of thick hair in the front, you will have thinning hair in the back. The doctor must find a balance. Take enough so that the effect in the front looks natural, but at the same time do not steal from the back of the head. This is planning, not improvisation. That's why when a clinic promises you a mega session, 6,000 grafts in one day, ask yourself, can my bank afford this? And has anyone even checked how much I can safely give? Thank you for participating in the lesson, and of course, I invite you to the next one. I also recommend the guides 101 Questions about Hair Transplants and The Secret Life of Hair, which are also available for streaming.